Okay, it's time to talk about the flu. And folks, I don't want you to be mistaken. The yearly flu shot has never been 100% effective. There's no such thing as a sure thing. There's always been a chance that you could still get the flu after you get the flu shot. That being said, this year, boy, it seems like there's been an awful lot of people who have gotten the flu despite also getting the flu vaccination. So to talk more about flu season and just exactly what is going on this year and what's going on with the effectiveness of the flu shot, I'm happy to be joined right now by Dr. Paul Skolnik. He's the chair of medicine at UConn Health. Thank you so much for taking the time to talk to us, sir.
My pleasure.
First things first, yeah, okay, what is exactly going on here? Because we're hearing different news reports that it's only 23% effective or 50% effective. Why isn't it 100% effective?
So there are a couple of things going on this year. First, there's more influenza circulating in the community, and it's easy to spread from person to person. The second thing that's going on is there's a different strain, as we call it, of the flu going around. The H3N2 strain, it's got a name. And that is both more severe than the typical flu and is also not represented in our current flu vaccine. We guess the year before, based on the strains that are circulating in the community, what to put in the vaccine.
Okay.
And since this is a different strain, it's not in the current formulation of the vaccine.
So just to clarify, there's not just one type of flu. We call it the flu, but there's all different strains, and doctors have to get together, and you literally just, I guess, use an algorithm or guess which ones to put in each year?
Exactly, and it's a laborious process to create the vaccine. The virus is grown on eggs, and then this is all put together in a formulation. We're trying to invent new ways to make that process quicker so we can rapidly get the flu strains that are in the community into the vaccine, but we're not quite there yet.
Okay, it takes what, about 3-4 months to?
It takes even longer than that, probably 7 or 8 months, so almost a full year, including the ramping up and making large quantities of the vaccine.
Now, you mentioned it's H3N2 is the dominant strain this year.
Right.
I'm also hearing that there's been some, I guess, genetically it's starting to mutate, and has that been part of the problem?
So that's all part and parcel of what I'm talking about. So we talk about drift and shift, meaning that, yes, the virus mutates and new forms of it arise, different combinations of the genetic material, and creates these different strains. The body's immune system doesn't recognize these new strains that haven't been around before, and therefore people aren't protected as they might be, either from the vaccine or from having encountered the virus before.
Okay, so to get to some actionable information, about how protective is this year's version of the flu shot, and how protective is it on any given year on average?
Yeah, so usually we're doing well if it's 60 or 70% protective. This year, the estimates have been between 20 and 30% effective, so very much lower than typical. That's why doctors, infectious disease physicians, are really concentrating on using the drugs that we have to treat influenza early on. Tamiflu is one of them, Relenza is another one. It's important, especially since this virus can cause real problem, to give those medications appropriately if someone really has the flu early on. People don't realize it, but every year in the United States, even on good years, between 30 and 40,000 people a year die from the flu.
Yeah.
Mostly very young, very old, but we want to make sure that it doesn't go any higher than that, and maybe if we can lower that, it'd be even better. For
all the talk about Ebola, 0 deaths in the U.S. versus 23,000 from inborn infections. Okay, you said roughly, you say it's 23% effective. Am I assuming there's still the recommendation to get the flu shot because 23% is better than 0?
That's exactly right. So for those 20% of people or 23% who are going to be protected, we absolutely advise people to get the shot. And it's not just for yourself, it's to protect others, because it is so spread so easily through the community.
Yep.
If you get it, your loved ones, close contacts at work are at risk as well. So we do recommend that everyone still get the flu shot.
Now, if you do contract the flu or the H3N2, is that shot going to give you any sort of help in fighting the infection that you get?
It could. If the strain is somewhat related to what's in the vaccine, it might lessen the symptoms. It might attenuate the severity of the illness. So that's another reason to get the vaccine as well.
Now, this idea that H3N2 may have drifted genetically and therefore the shot's less effective, it's not all that uncommon, right? Didn't it happen, I think, in the mid-2000s?
Yep, we've been through this situation before. In Connecticut, we're up to almost 400 cases. We're ahead of the curve. There's been one death in Connecticut already in an elderly gentleman. But when you get the drift, we see what we're seeing now. When you get the shift, there can be real epidemics worldwide, and those can be devastating. We're not in that situation right now, but it's still a serious situation and one that we're working to prevent serious consequences.
Okay, Mr. Skolnik, thank you so much for your time.
Thanks so much.
Thank you.